Good afternoon and welcome to the conference. My name is Gillian MacDonald.
And I am Purav Tailor, and we are here for discussion of exercise recommendation for clients with multiple sclerosis.
We're going to start with a quick overview of what MS is and how it affects the body. The exact nature of MS is still not known, but it's thought to be an autoimmune disease that affects the brain and spinal cord by causing demyelination of the nerves. This prevents nerves from being able to properly send signals along their axons, which can lead to a wide variety of symptoms depending on which nerves are affected. A lot of the risk factors here show why it's very important for us to study MS here in Canada. People of Northern European descent or who live in northern climates are at a higher risk for developing the disease, as are those who lack vitamin D. As we know, these are very common traits for us Canadians. Genetics have also been linked to MS, as has being female. Interestingly, there may also be some viral connection as well, since many MS episodes are preempted by a viral infection.
Multiple sclerosis affects mainly the central nervous system, and that's why the symptoms and signs has wide variety of ranges. Symptoms which have major impact on the quality of life of an individual are fatigue and weakness, spasticity, tremor, cognitive impairment, depression, and heat intolerance. Regardless of symptoms, progressions of disease is measured by disability over the period of time. There are four major types of multiple sclerosis. They are relapsing remitting, secondary progressive, primary progressive, progressive relapsing. Studies are mostly focused on relapsing remitting type of multiple sclerosis. That's the type we will talk about.
Now we'll discuss how MS can affect a client's physical activity. Physical activity and exercise can easily fall by the wayside after a diagnosis of MS. Studies show that only 20% of people with MS engage in sufficient amounts of exercise compared to 40% of healthy controls. Depression is a major symptom that prevents people from exercising. About 50% of clients with MS will develop the disorder, which has also been linked to cognitive impairment, decreased quality of life, and poor compliance with disease-modifying therapies. This presents a tough challenge to overcome when trying to incorporate physical activity into your routine. Fatigue is a common symptom in many autoimmune diseases, and this is especially true with MS. When a client feels fatigued, it can be very difficult to find the energy to exercise, so many people simply don't. Spasticity, tremors, and muscle weakness can further impair a client's ability to follow through with a regular exercise routine. Interestingly, several studies have indicated that those with MS consume oxygen at a higher rate compared to healthy controls, and this means that they are more prone to fatigue during exercise. All of these factors combine to create an environment that can make it difficult to follow a regular fitness schedule.
Now we will see what exercise is. Exercise has been defined as a planned, structured regimen of regular physical activity deliberately performed to improve one or more component of physical fitness according to Ansari and colleagues. However, according to our research, physical activity did not mean structured exercise. In fact, an accumulation of 30 minutes of physical activity during daily life is as beneficial and perhaps more achievable than structured exercise. Previously, exercise was considered harmful and not beneficial for the persons with multiple sclerosis, as it was not feasible for them to participate in exercise because of tendency to fatigue easily. But from our research, we have found that exercise is beneficial for multiple sclerosis. But the condition is that it has to be tailored according to the needs of an individual. Patients with multiple sclerosis who are ambulatory and have mild to moderate disability can tolerate exercise and are likely to benefit from supervised exercise program that includes aerobic, balance and strengthening exercises applied in an individual or group setting. It has been reiterated in research that exercise training can yield a small yet statistically significant and reliable reduction in depression symptoms in persons with multiple sclerosis. It has been also shown that there is significant increase in Berg balance scale and 10-meter walking test in group exercises. There was an increase in functional activities such as walking and stair climbing. It is known that spasticity has a negative effect on balance and mobility. It has been believed that strengthening and resisted exercises cause increased muscle tone and showing beneficial effect on spasticity. So exercise is an effective intervention for many impairments without the negative side effects of the drug.
The Multiple Sclerosis Society of Canada and the Canadian Society of Exercise Physiology have created guidelines for physical activity in conjunction with Dr. Amy Latimer Chung of Queen's University. They recommend that aerobic and strengthening exercises should each be done twice per week, with at least one day of rest in between strength sessions. For aerobic activity, they suggest working up to 30 minutes at moderate intensity, and for strengthening exercises, up to 2 sets of 10 to 15 reps, using weights that allow the client to barely but safely finish the reps. There should be 1 to 2 minutes of rest between each set and exercise. When helping a client develop an exercise plan, there are a few things you should keep in mind. First, your client may be experiencing differences in leg strength due to how their nerves are being affected bilaterally. A 2014 study showed that many people with MS have this disparity, and it greatly affected their ability to cycle because one leg fatigued much more quickly than the other. When developing an exercise plan, check for any strength differences in your client and adjust accordingly. This will reduce the risk of underworking one side while overworking the other. Secondly, early fatigue can be a major concern for clients trying to add more physical activity to their lives. The key is to remember to start slow. If a client can only do 10 minutes twice a week to start, that's perfectly fine. Remind them that their job is to work up to 30 minutes twice per week, not do more than they're ready to. If they take it slow, there will be fewer physical setbacks, and when your client sees their progress, they will be very happy they took the time to work within their own capabilities. Finally, we return to the symptom of heat intolerance. Exercise naturally increases body heat production, which your clients may find difficult to deal with as it can exacerbate their symptoms. Advise them to work out in well air-conditioned environments, to stay hydrated, to not wear excessive clothing, and to take breaks as often as needed. There are even products available like cooling vests and hats, so have information on hand if this is something your client may be interested in. Remind your clients that heat intolerance does not pose a threat to their overall health and that symptoms should disappear with rest and cooling. It can be scary to experience an increase in symptoms, so be patient and reassuring to support your clients over this hurdle.
Exergaming. It is use of games to make exercise enjoyable and fun. It is tool to facilitate exercise, balance and encourage training. However, current study shows that it is beneficial in patients with stroke, but more research needs to be done for the patients with multiple sclerosis.
We're going to finish off with some closing thoughts. So, every study that we read only used ambulatory MS clients with relapsing remitting MS. Because of this, we would like to see more studies done with clients who are less mobile and who are experiencing more advanced symptoms to see if they respond favorably to exercise, and to develop parameters for how exercise should be performed. The MS Society and CSAP described some of the best options for physical activity. Arm and leg cycling are frequently used in studies and with great success among MS clients. Other options include aquatics, calisthenics, and elliptical training. Free weights, cables, and resistance bands are all excellent options for strength training. And although our primary role as massage therapists is to provide our clients with hands-on treatment, home care is a huge part of how we can help clients heal. Work with other professionals within the circle of care to create tailored exercise plans that will help your clients stay strong and healthy.
Thank you very much for listening to us, and we hope you enjoyed our presentation. See you next year with more exciting research. Bye and have a great year ahead.